Hey buddy, my name is Colin. I'm gonna be your nurse today. Can you tell me your name and date of birth?
Luke Leatherwood, 0502-2000.
Okay, I've done hand hygiene and provided privacy. First thing I'm just gonna do a physical assessment on you, listen to you, check you out a little bit. First thing I'm looking at is your head, symmetrical. Any headaches lately? No? Okay. I'm gonna look at his ears. They're symmetrical, no drainage. Any trouble hearing? Okay. And we're gonna do eyes. Look straight at me. Pupils are about a 3. Left pupil's about a 3. Right pupil's about a 3. All right, look straight at me. We'll assess your pupillary response. All right, look at that back wall right there. Pin is about 6 inches in front of his face. All right, when I tell you to, look at the tip of this pin, okay? Okay. Good deal. Any blurry vision? Anything like that?
No.
Okay. All right, look up for me. We'll expect the nose. No deviated septum. Any kind of drainage? Any regular nosebleeds? Anything like that? Okay.
No.
All right, and we'll do the mouth, throat, and neck now. Get you to open your mouth, say and look up again. Looking at his neck, making sure his trachea is not off center or anything like that. Okay. Swallow for me. Any trouble swallowing? Okay. So for neurological, he's asked me everything. He's done everything that I've asked him to do. He's alert and oriented to person, place, time, and why he's here. So all of his GCS, he's opening his eyes, he's talking to me, and he's moving as I'm asking to, so his GCS is fine. Any trouble remembering things, no memory loss of any kind, okay? Any recent head injury, anything like that? All right. All right, we'll check out your lungs, see how they sound. Well, let me inspect your respiratory rate real quick. All right, respiratory rate's about 16, it's non-labored, and check out your lung sounds, okay? All right, we're gonna do right upper lobe. Deep breath for me. Left upper. Left lower. Right lower. Okay. Put your arm across the chest for me. This is lateral left lobe. Deep breath. All right. Same thing on the other side. I'll do right lateral lower lobe. Go ahead. Good deal. All right, now we're gonna do posterior. We're gonna do left upper lobe. Go ahead. Right upper lobe. Right lower lobe. And then left lower. Any shortness of breath?
No.
Let's see. Get you to cough for me. Any Anything coming up? No? Alright. And you know if he was a bedbound patient, we would tell him to turn, cough, and deep breathe, turn on the side, cough, take a deep breath, and then incentive spirometer about 10 times an hour, just while you're sitting there in bed. Now we're gonna do cardiac. Check for jugular vein distension, so look to your left for me, look to your right. Okay, no JVD. Do some, check out some pulses. So listen to his left radial pulse. Feel his left radial pulse. Give that about a 2+. And then we'll do right radial. And then his brachial pulse is up here, axillary is armpit, carotid is in the neck, femoral is in your groin region, popliteal is behind the knee, posterior tib, down here on the back side of your ankle, on the medial side. Give that about a 2+, and then dorsalis pedis pulse is on top of the foot. We'll give that a 2+. And I would do that on both sides. We'll do capillary refill, checking for edema, see your fingers. We want it less than 3 seconds, which it is, no edema. And then we'll do lower extremity edema, nothing there. And then we're going to listen to his heart sounds. So we've got aortic valve, pulmonic valve, Herb's point, tricuspid, and mitral valve. And then I would flip the bell over if I had any concern of like a S3 or murmur. No chest pain, no leg pain when you're walking, anything like that. Cool deal. Then we're gonna move on to the GI system. Usually I would lift the patient's shirt up, inspect, make sure there's equal hair growth all throughout on the male, make sure there's no discoloration, any bruising, anything like that. So we're going to inspect, and then we auscultate bowel sounds. So we're going to do right lower quadrant first, right upper, and left upper, and left lower. And then we're going to palpate in the same motion, same pattern. Any pain? No. No pain over here. Good deal. Any trouble having a bowel movement? Passing gas? Pretty
No.
good. Okay. Alright. Let's see. No stomach pains, you said?
No stomach pains.
Okay. Now we're going to do musculoskeletal. We're going to assess his elbow joint. It can extend and flex. There's no hyperextension, which is good. Wrist joint. We're going to do supination and pronation. And then we'll do knee joint. So extend your knee for me. Back to flexion. And then we'll do ankle. Plantar flex and dorsiflex. Good deal. Any muscle pain, weakness when you're walking, anything like that?
No.
All right, I'm gonna get you to stand up and walk that wall for me. We're gonna come back. Gait looks good, he's not off balance. And then any trouble peeing and burning, anything like that?
No.
good.